The bacterial infection of Bordetella pertussis causes a whooping cough, which leads to the development of pertussis. The illness produces a prolonged cough that produces a distinctive whooping sound, which can result in dangerous health issues, mainly affecting babies and small children and the elderly with compromised immune systems. The CDC identifies pertussis as a major public health threat because it causes many new cases throughout the United States every year. The gram-negative bacterium Bordetella pertussis infects respiratory tissues to create airway inflammation, which results in tissue damage. The bacteria creates toxins which disrupt respiratory system operations to produce pertussis symptoms, including coughing and wheezing and difficulties breathing. The disease spreads through respiratory droplets, which form when people cough or sneeze and through direct contact with infected persons. Medical professionals diagnose pertussis through physical checks and patient background review and laboratory testing. The PCR test, which is the polymerase chain reaction test, serves as a primary diagnostic tool to identify Bordetella pertussis genetic material in respiratory fluids. Healthcare providers use culture tests and serology tests together with PCR tests to verify pertussis diagnosis. The CDC recommends healthcare providers to assess pertussis as a possible diagnosis when patients experience persistent cough and lack vaccination records and have exposure to someone with disease. The World Health Organization, or abbreviated WHO, shows that pertussis infections affect millions of people worldwide annually, while causing major health issues and fatal outcomes, mainly in regions with limited vaccine availability and insufficient medical care. The WHO recommends pertussis vaccinations for all children beginning at 2 months of age to establish protection against the disease. The WHO supports adult and adolescent vaccination programs to stop disease transmission while maintaining their immune status. Multiple trustworthy organizations exist to provide accurate and current information about pertussis for people who want to learn more. The CDC, together with WHO and the NIAID, operate as trusted sources which provide accurate information about pertussis and other infectious diseases. These organizations offer detailed information about pertussis causes and symptoms and diagnose methods and treatment options and vaccination and prevention guidelines. What I found interesting about this specific bacterial infection and why I was interested in it was that during the summer of last year, a few days before school was ending for the summer, my son had went over to a friend's house to stay. And when he got back that next day, my son was very lethargic, burning up with fever and extreme weakness. The doctor had told me it was pertussis, and of course I had a shocked look on my face because my son had been vaccinated at 2 years old with the Tdap. So the treatment for him at that time was a Z-Pak, cough suppression medication, and staying in isolation for 5 days. And I had recently taken that Tdap immunization about a month prior to him becoming infected because I needed my vaccinations for nursing school. But the health department did also contact me, and they were doing a timeline of where the outbreak had started. And it was told to me that it seemed like in the middle school age children were the ones who were getting infected, and there were a couple of elderly adults also. But there is, for people who want to know more about pertussis, should visit the sources that I stated earlier, the CDC, the WHO, and the NIAID.